Preventative medicine is key to our overall health and well-being, and at Mercy Health, they offer a number of cardiovascular screening options to help you maintain optimum heart health.
This Cincy Lifestyle Health segment, sponsored by Mercy Health.
My name is Francisco Lopez. I'm a cardiologist at Jewish Hospital in Mercy Health. I'm a non-invasive cardiologist with a subspecialty in cardiac imaging. I think the most important thing is that screening and early intervention is the best way to go. Prevention is key and is the best way of avoiding any further issues in life within your cardiovascular health. We do a very good physical exam, and we talk to the patients for quite some time, make sure we gather all the information that we need regarding themselves and family history to see if they're prone to develop any cardiac issues within their life. And based on that, we decide what type of testing they need, if they need basic screening testing or more advanced testing. We have different modalities of testing. We can go from the most basic testing, including echocardiograms and EKGs, and we can go as fancy and complex as cardiac CTs and MRIs, trying to diagnose the most complex valvular and heart disease. Typically, we see heart failure, valve disease, including valves that are leaky or valves that are tight, meaning that they may need to get surgery, and we see cardiac arrhythmias as well. We spend plenty of time with them in the office trying to make sure that they understand what's the process, what options we have for testing, and what we're thinking in terms of what diagnosis they may have. And depending on that, we try to reassure that we're going to be doing the necessary testing in order to help them. It depends on what we're looking for. For basic screening, we have the different options of doing carotid ultrasounds, a basic EKG and abdominal ultrasounds to make sure that someone doesn't have an aneurysm. And then we can move on along as performing coronary calcium scores and then fancier CAT scans of the arteries to make sure that they don't have any degree of blockages. For arrhythmias, we have different options. We can go from the most basic EKG in the office to extensive monitoring that can go between 2 weeks, a month, or even longer with implantable devices. So we have a different set of options depending on what kind of symptoms and arrhythmia the patient may have. We have all the different specialists capable of treating anything between valve disease requiring surgery or minimal invasive treatment. We have a specialist dedicated to heart rhythm issues. We have a specialist dedicated to heart failure. So we do have the pool of people required to treat any different complex cardiac condition. For more information about our specialties, you can go to mercy.com and you will find plenty of information and contact information how to reach us.